Senate Republican leaders aiming to salvage efforts backed by President Trump to dismantle the Obamacare law. This was unveiled as new health care legislation in the Senate today, and here's what you really need to know about the bill, okay? Number one, the consumer freedom option put forward by Senator Ted Cruz is part of this bill. The idea, controversial, but essentially it would get rid of the one-size-fits-all insurance under Obamacare and allow insurers to offer a variety of plans. Number two, you can forget tax relief if you're well-to-do. The bill reinstates Obamacare's 3.8% surtax on investment income for households earning $250,000, as well as that 0.9% hike in the Medicare payroll tax. So much for those Republican promises to get rid of Obamacare taxes. Number three, Medicaid funding gets tweaked. Probably not as much as liberals want, but there is an additional $45 billion for opioid addiction treatment and $70 billion more for the states to help drive down premiums. All right, we got a lot to talk through. Here to discuss, Avik Roy, Akash Chugli, and Ned Ryan. Welcome all. Avik, I'm going to start with you. So today we heard McConnell say it's time for the Senate to rise to the occasion, and he's chiding Republicans to get in line and support this bill. They're voting next week. My question, can he even get it to the floor?
Well, he's got a strong argument. Get it to the floor and then vote it down if you don't like it, or offer your amendments to change it, or what have you. Right now, his margin of error for getting it to the floor is exactly zero, because Rand Paul and Susan Collins have both said they're not going to vote for that. Right.
And Ned, to you, do you agree? I mean, can they get this going at all? We've been through how many iterations of this bill? Two in the House. Now, this is the second one in the Senate, and more are promised. We even had Lindsey Graham today out with his own new idea. I mean, you know, these bills are a dime a dozen now, my friend.
That's right. I think the thing that's frustrating to some of us is that we had 7 years to figure this one out. I think it was a failure of leadership that there was not a sit-down meeting right after the elections to say, here's our plan moving forward, here's our timeline, here's our agenda, let's make it happen. That all to say, I mean, they do have to bring it to the floor under the budget reconciliation guidelines. They have to have 20 hours of debate and unlimited amendments. Bring it to the floor. Let's have this debate. But, Jerry, I think the thing that's interesting in all of this debate about reforming health care, repealing Obamacare, all that, nobody's really talking about something I think they should be talking about.
What's
We're talking about lowering premiums and deductibles. We're not actually talking about lowering costs.
I know.
What does stuff
listen,
actually
this is a complicated,
cost?
We're going to break this down. And it is a complicated conversation. Akash, I want to ask you this, though. You know, last week, the White House said, hey, the Democrats are much more organized when it comes to health care. Why aren't we? What'd you make of that? What'd you make of those comments? And is it really hurting the efforts this week to bring this bill forward?
Well, I think it's been hurting the effort the entire year. As Ned touched on, they had 7 years. They ran on Obamacare repeal over and over and over again. They must have just been expecting that this moment would never actually come before us. What they really should have done is put that 2015 repeal bill on the floor as the first thing they did this year. Would have been interesting to see them take up that exact same bill and see who flip-flopped on that when it actually counted. The Democrats beat the Republicans to the punch a few years back, and now it's disappointing to see where this debate has come 7 months into a full Republican control.
It's not 7 months, it's 7 years. The Republicans, Ovik, had had an opportunity to get their act together, put something forward, and we're still waiting for the one comprehensive bill. You know, I'm hearing there's even more new proposals in the offing coming from senators. What I found interesting, though, when I read the details of this, and I spent a lot of the morning kind of pouring through that, it's really what they tried to do is scrub the mean out of it. There was another comment from the president saying that he thought the Senate proposal, the first one, was mean. I think they're trying to make a new start here. What do you say?
Well, a lot of that's Democratic talking points, so yeah, they're trying to address some of that. But to Ned's point, you know, there's a lot of disagreement among Republicans as to how to reform the health care system. The moderates and the conservatives and the mainstream Republicans all have different ideas. So it's not like there was no sit-down, there was no meeting. There were tons of meetings. The problem is that people disagree, and this bill is attempting to split the difference between the different factions or poles of the Republican Party.
Ned, you were saying that what we need to focus on is costs. I think we also have to focus on is getting actual health care to the people, right? Like, if you can't afford it, you're not going to get the services, and I think that's the big frustration folks have. Tell me what you mean by fixing the cost.
Well, it's pricing transparency. If people truly understand, you want real market reform, you have pricing transparency. What are the actual costs of procedures? And somebody, I would love to have them propose an amendment to this bill of saying, you know what, we are going to require people to start posting cost of what procedures actually cost. Here's the dirty secret, Jerry.
Right.
Insurance companies and medical providers, guess what? They want costs to go up. They want a low-volume, high-margin approach What we actually want is a high-volume, low-margin approach that will benefit the American people. So there are some fundamental things that if somebody can propose an amendment like this, we could actually see the American people walk away as the beneficiaries of this instead of the insurance companies.
And Ned, you know, there's a lot of controversy surrounding money that's going to go to the insurers here. It looks like they're going to get bailed out. I mean,
that's right.
That's not the right thing, is it?
No.
Well,
no,
I think Jerry is also pointing out
that
I think what Ned is touching on, so much of that conversation about lowering health care costs has almost nothing to do with health insurance, right? It has to do with the supply of health care, buying insurance across state lines, nurse practitioner licensing, medical malpractice. So much of that doesn't have to do with the insurance conversation. We've just come so far down this road of putting an insurance card in everybody's pocket and losing sight of the real goal, which is to lower costs.
But you want to be able to get care at the end of the day, right? If you can't afford it, you're not getting care. And a lot of these networks, the choices are so narrow, so small, maybe one doctor, maybe one hospital. You're not really getting what you pay for, right, Avik?
I mean, Jerry, the thing about all this is that at the end of the day, it's about repealing and replacing Obamacare, this bill. It's not about reforming every single aspect of the health care system. We don't want a single bill that's 5,000 pages that reforms every single part of the health care system. Right. So this bill has a narrow focus, repealing and replacing Obamacare. Does it do a perfect job of that? No. But would it be better than the status quo? I strongly believe it would be. And that's why it deserves to have a hearing on the floor of the U.S. Senate instead of being bottled up in hearings.
You know, Ned, one of the constant complaints I hear from the Republicans is that their original bill in the Senate was completely misunderstood, and that instead of, you know, they weren't cutting millions of people off at the pass, right?
That's right. The
coverage wasn't going to go away. They were really just constraining the growth of Medicaid, say, over time. You agree with that?
I totally agree. I mean, under Obamacare, Medicaid was going to expand by $231 billion. Under the Senate plan, they were still going to expand Medicaid by $73 billion. But it kind of ties into your earlier point, and Avik's made this point in some of his pieces. Just because somebody has Medicaid coverage doesn't actually mean they're getting care. Over 30% of doctors in the United States do not accept Medicaid patients. And so there are some fundamental conversations going on of why are we putting more money into a dysfunctional system of Medicaid instead of actually going for real reform. And so part of that debate is, as Avik has mentioned, between the more liberal part of the Senate and the more conservative is about this whole Medicaid expansion. I think $73 billion additional funding into a failing dysfunctional system without going for real reform doesn't make sense to me at all.
So, Ned, I mean, how do they square this circle? Because getting enough Republican votes is almost impossible, right?
No, I mean, no, you're right. I mean, this is the political reality. Again, I think Avik's right. You've got to get this to the floor, 20 hours of debate, unlimited amendments. At the end of the day, here's the thing. This is going to have to go back to the House, who's either going to pass it straight up and down or amend it, or they're going to have to go to conference. We're nowhere near the finish line, and I think what we're actually debating and talking about right now, the final bill, hopefully, that will eventually get to Donald Trump's desk, is not going to look much like what we're actually talking about right now.